So why are elective surgeries being postponed? Because we're in the middle of a crisis. This is a true pandemic. So first of all, we need to make sure we have all the protective equipment we can have for our personnel. These healthcare workers are putting their lives at risk to take care of our Kansans. We want to make sure they have all they need to protect themselves when they're doing so. Secondly, we don't want to expose our patients to COVID. It's, we don't know who's been exposed but not yet symptomatic, right? So they could be at risk and not know it. Additionally, we don't want to put ourselves at risk for somebody else who may have COVID. And the rest of the thing is, patients may not get the care they would otherwise get because there's a tremendous amount of focus on COVID right now. Tensions are high. People are concerned. Not the time to be having an elective operation done. It's one thing if you have a broken hip, all hands on deck, fix the hip because that's a life-saving operation. If you've had arthritis of your hip for 5 years and you were scheduled to get your hip replaced last month and now you have to wait a couple of months for it, much safer than coming in to have an operation at a time when there are other things on lots of people's mind. Question is, who's involved? Who's doing this? Who's limiting elective surgery at this time and why? We talked about why on a personal nature, but it's a national directive. The Surgeon General suggested that we do this a couple of weeks ago, as did the CDC. These are large bodies that they do this with large bodies of information to make appropriate recommendations for our country. We know it's the right thing to do for our state. So doctors should be doing that. Hospitals should work together to make sure that these kind of surgeries are limited. And it's not without sacrifice. We're sacrificing something we love to do. We love to operate. We love to take care of our patients. But our department alone has now put 600 cases, 600 patients waiting for their surgery because we think it's the right thing to do. So maybe predictions will change and things will be much better and we can get back to operating sooner. But right now, we've already limited our surgeries that we're not planning to operate for at least the next month so that we know we're here and we're focused on taking care of our Kansans and the COVID they may have. To my colleagues around the state, what can you do? Look at what we're doing. Look at what UAMS started doing. We saw there was a pandemic that was going to affect our state. We started testing early. I'm sure you've seen the drive-up testing, the fact that we have testing or screening on the internet. These are things you can do to help screen your patients, to help protect you, your staff, and your other patients.